If you truly want to get on top of your health and symptoms in 2026, the very first step is getting a full comprehensive blood panel. Most women have no idea what's actually going on inside their bodies because their labs that are typically ran through insurance are very basic. They're designed to catch disease and not to help you feel your best. So usually what gets covered is a basic metabolic panel, maybe a lipid panel, maybe TSH for thyroid, and that's it. But those labs barely scratch the surface of what actually matters in perimenopause and menopause. Here are the essential labs to test at this stage. First is hemoglobin A1C. This tells us the average blood sugar of the past 3 months. Blood sugar dysregulation is one of the biggest drivers of weight gain and fatigue and cravings and inflammation during this phase of life. And along with hemoglobin A1C, fasting insulin. Now you can have normal blood sugar and still be insulin resistant. And insulin resistance makes fat loss incredibly difficult and is a driver for inflammation. Next, a full thyroid panel. But most doctors only test TSH, which is not even a thyroid hormone. Free T3 is the active thyroid hormone in your body, and that's what affects your metabolism and your energy and your mood and your weight. If free T3 is low and non-optimal, you will still feel exhausted all the time, even if your TSH is normal. And then a full iron panel. This is huge in perimenopause. With heavy or frequent bleeding, many women slowly become iron deficient. And low iron can increase fatigue and dizziness, shortness of breath, hair loss, anxiety, and iron often gets completely missed. Next is all your cholesterol important numbers. When estrogen declines, your LDL cholesterol often increases. That's why I also look at apolipoprotein B, which is one of the most important markers for cardiovascular risk in menopause. And finally, hormones. Yes, hormones do fluctuate in perimenopause, but if you're still cycling regularly, checking your estrogen, progesterone, and testosterone at the right time of the month gives us valuable information. Now, if you're postmenopausal, getting a baseline before starting hormone therapy is essential so that every 12 to 14 weeks we can recheck your levels and make sure they are moving up to the optimal ranges where you feel your best. And now this part matters. Doctors are trained to look at normal ranges. But normal does not mean optimal. Optimal ranges are about how you feel, how your body functions, and how you prevent problems long term, not just whether you're sick enough on paper. If you want 2026 to be the year you truly shift the needle with your health, this is where it starts. With data, with clarity, with somebody knows how to interpret labs and checks labs through a menopause-specific lens. If you're interested in getting a comprehensive blood panel done through a simple and quick process and get the answers you truly need, just comment or DM me the word labs and I'll walk you through the next steps.